Hello, today we're going to be working on the appendicular skeleton. So the last video we did on the skeleton was on the axial skeleton. Today is going to be the appendicular skeleton. So the first thing we're going to start off with is going to be what we call the pectoral girdle. The pectoral girdle is made up of these two bones. With these two bones, you're going to have your clavicle, which is often called your collarbone. It's going to be seen on the skeleton right here and right here. And then you have your scapula, which is going to be your shoulder blade. And that's going to be found on the posterior section of the skeleton right here. So with these two bones, the parts that you're going to need to know for your test are the name of the bone, which this one's the clavicle, and you need to be able to orient yourself. So it has a slight S shape. This is going to be the body portion of the clavicle. The portion that is more up and down is going to fit right here with the sternum, so that is referred to as the sternal end or the medial end, because it's towards the medial portion of the body. The other side is going to be called the acromial end or the lateral end. It's on the lateral portion of the body, so it's found right here, and it articulates with the acromial process on that shoulder blade. So here you have your shoulder blade. It'll come in, and it will articulate right there with it. So you can see. So turning it around, the acromial end or lateral end, the acromial process. Now we're going to move on to the scapula. With the scapula, the part that's going to be nice and smooth is going to fit in towards the rib cage. The portion that has the spine sticking out, that is going to face the posterior portion or the outward portion of the back, like you see here on the skeleton. Now, the parts that you need to know for your test, you have the spine, and going towards the end of it, you're going to have the acromion process. So that is attached in with the spine of the scapula. The next part you're going to have is going to be this part that sticks out here. Kind of looks like a bird beak. That's called the coracoid process. Corac means bird beak. So that's the coracoid process. There's an indentation in here. It's going to be a nice cavity, and that's going to help to articulate with the humerus. So it comes in and fits in nicely. That's going to be called the glenoid cavity. Now, what are you going to do if you're trying to figure out if this is a right or a left side, or if it's the anterior or posterior? So like I said, posterior is always going to have the spine, and it's going to come down. You're going to articulate it with the humerus. The head of the humerus is going to come in. So you know that this is going to be the lateral side. So with the lateral side, you have the lateral border, which is kind of oblique. You're going to have a nice straight up and down border here, which is going to be called the medial border. That medial border is going to need to align itself here with the vertebrae. So putting it here, you can see how it's straight up and down for that medial border. You've got your vertebrae. So that means that this one is going to fit in like this. So that is going to be my right hand. And so that is a right scapula there. So parts you need to know really quick. Spine, acromion process, coracoid process, glenoid cavity. So that's what you need to know. So that's going to make up your two bones that are found in the pectoral girdle. So if I asked you a question, what two bones make up the pectoral girdle, you're going to tell me the scapula and the clavicle. Now moving on down to the arm. The upper arm bone is going to be referred to as the humerus. With the humerus, there's going to be several parts that you're going to need to know. I have narrowed these down for you. So first thing, you need to be able to orient yourself and tell, okay, what's the front, what's the back, what's the anterior, what's posterior, and which arm is it? So looking at this one, you would turn it around, you would look at the different parts. Right away, I know that this deep indentation is called the olecranon fossa. That's going to be found on the posterior section, so it needs to turn this way. You know that the head right here is going to need to come in towards that glenoid cavity. So it's going to come in towards the body, so it's medial. So if I need this coming in towards the body medial, that tells me that that is my left arm, or that would be the left humerus. So going into the humerus, let's go over some different parts. I'm going to try to put this up close right here so you can see it. All right, so with these parts of the humerus, you're going to have the head portion, you're going to have what's called the anatomical neck. It's kind of like an oblique section through here. You'll have what's called the surgical neck that goes around the main portion right there. So it's the surgical neck. So anatomical neck, you can kind of see a line going around it. It's oblique, and head. Now with this, you're also going to have tubercles. You'll have what's called a greater tubercle and a lesser tubercle. And so those portions, you're going to see these tubercles are going to be bumps right here. So the greater tubercle is up higher, and the lesser tubercle is down lower. So you'll see these tubercles here. Next thing you need to know, we're going to come on down, and you will need to see where there's a slight pull or a slight process that comes out. That right there is going to be called a tuberosity, and it's the deltoid tuberosity. So with the deltoid tuberosity, that's where the deltoid muscle, which is going to be this muscle here that you often get immunizations and shots in, that's where it's going to come in and attach to the humerus. Now, the more that you use that bone, the more prominent this tuberosity will be. So if you lift weights, if you play tennis with that, and that's your serving arm, if that's the arm that you use quite often and you do a lot of physical activity with it, this tuberosity would be more prominent. If it's like an infant or if it's somebody who's bedridden, this tuberosity is going to start to kind of go away. These bone markings won't be as prominent because there's not as much pull on the bones due to them not being pulled on and used for muscle. All right, coming on down, we're going to look towards the bottom. I'm going to come in closer. So with this, you're going to have a piece right here. It's going to be medial. That is called your trochlea, right there. Then, over to the side, you have laterally a more circular piece. That is going to be called your capitulum. So you got the trochlea and the capitulum. Now, these indentions that you see up top are going to be your fossas. So the one here that's going to be above the capitulum is going to be called the radial fossa. The one beside it that's over top of this trochlea is going to be called the coronoid fossa. So remember, we had the coracoid in the scapula. Now we have the coronoid, which is going to be found in the ulna, and that piece is going to articulate right here with the humerus. Next, we have epicondyles. Trying to straighten it out. So since this is over to the inner portion, that is going to be called your medial epicondyle. Since this over here is going to be laterally, that's going to be called your lateral epicondyle. I'll let you see it's like a rough piece here. It is separate from the capitulum. It is not part of that capitulum. It's going to be this section here. So those are your condyle or epicondyles. Medial, lateral. Now flipping it on over to the back, you have this deep indention here. That is going to be where the olecranon process of the ulna comes in. I'll get it closer. It's a very deep indention. It's posteriorly. And so that's called the olecranon fossa right there. So I'll show you the ulna, how it comes in, and how it's going to articulate. So you see the coronoid fossa going in with that coronoid process, so it makes a nice deep indention. The olecranon process is going to come in, and you can see how it goes into that olecranon fossa, or that indention. So like we said, this is the ulna. Ulna, easy, makes a U. So we have the olecranon process, the coronoid process, and then this piece here that's going to fit around the trochlea. It's called the trochlear notch. So that is going to be this indention, the C portion inside. Things that you need to look for here, you're going to have a nice flattened piece here. That's going to go for the head of the radius to fit in, nice and neat. And so, I don't know if you can see it, it's a nice flat piece. That's going to be called the radial notch. Coming down with the ulna, the head is actually going to be on the bottom. So the bigger portion here, that's the head of the ulna. And then you have your pointy piece, which is going to be called the styloid process. Now that styloid process, you're going to need to say styloid process of the ulna, because we've already talked about one styloid process that was in the skull here, this nice pointy piece, which is the styloid process as found on the temporal bone. So that also, styloid process. So that's what you need to know for the ulna. Next, we have our radius. Radius has a circular head, so you can take the radius of it. It's going to have this bump that's coming out the side there. Move it around so you can can see that bump right there is called the radial tuberosity. Coming on down with this, you're going to have a styloid process as well. So that would be the styloid process of the radius. So we got the head, neck, radial tuberosity, which is that piece that sticks out, and then styloid process of the radius. So we're going to have 3 styloid processes that you're going to have to be able to label. Now, we're going to go further down into the hand. First thing I do with the hand is I orient myself. I look for the rectangular bone that's going to be proximal to the forearm bones. And so proximal means closer. Get close. So I look for the one that is going to be elongated here, and it's going to look like a rectangle. That's going to be your scaphoid. That's where you're going to start, and then you're going to go across. So you got your scaphoid, lunate beside it, triquetrum, and on the back side of the triquetrum, you'll see this little piece attached called the pisiform. Now it looks like a little garden pea, and so that garden pea is the pisiform. So let's go over that again. We've got our scaphoid, We've got the lunate, triquetrum, pisiform in the back, that little piece sticking out. Then we're going to go down, we find that scaphoid again, and we come down to the bottom row. And so now we're going to have our trapezium, our trapezoid beside it. We're going to have the capitate, which is the bigger one here, and then to the side of that, the hamate. Now the hamate has this hook, if you can see this hook coming up. And so that's also right below this pisiform. You see the hook of the hamate. Now, a easy mnemonic to remember to say is you can take the first letter of a sentence, make up your own sentence. There was one in the book that I had. It said, Sally left the party to take Cindy home. So Sally is going to be your scaphoid. Left is going to be the lunate. The is going to be your triquetrum. Party is going to be your pisiform. Starting back over the bottom row. You're going to have 2 is going to be the trapezium. Take is going to be the trapezoid. Cindy is going to be the capitate. And then home is going to be the hamate. So that's your 8 carpals that you need to know, and that's an easy mnemonic if you want to use that, or you can make up your own. Now, coming down from the carpals, we're going to go to the metacarpals. With the metacarpals, you're going to have 5 of those. You're going to orient yourself. You're going to find which side has the thumb. The thumb's going to be the shortest. And so metacarpal 1 is with the thumb. Metacarpal 2 is with the pointer finger. Metacarpal 3 is going to be with the middle finger. Metacarpal 4 is with the ring finger. And metacarpal 5 is going to be with the small pinky finger. So that's your metacarpals, 1 through 5. Coming down to the fingers, like I said, you can orient yourself. You can tell that your phalanges, which are your fingers, are going to be, according to the shortest one's your thumb, and so it's going to have 2 bones in there, and those bones are called phalanxes. So the one that's closest to the metacarpal is called the proximal phalanx. The one that's furthest away is called the distal phalanx. So that one only has 2. If you look at the rest of the fingers, they will have 3, and so you'll have proximal, middle, and then distal phalanx for those. So proximal, middle, distal phalanx. Now when you look at our skeleton here, I back him up and I'm going to put the camera down so you can see better. So when you're looking at him, notice anatomical position, you're standing palms facing out. Easy way to remember the forearm bones is that this radius goes in with the thumb, so I say RT, and then the ulna comes down to the little finger or the pinky, so PU. So we have RT, PU, and that's the easy way, or you can make up your own in order to remember how these are oriented. So anatomical position is how you're supposed to stand. Now when you're standing normal with your arms, the back portion of your hand facing out, notice how these bones are parallel anatomically, but then when you go to stand what I call normal, they cross over up top. Now they have an interosseous membrane in between that's keeping them together, but it is flexible. And these bones go from being parallel So crossing. So you can see that there. Now we're ready to go into the pelvic girdle. Now with the pelvic girdle, it's going to consist of 2 bones, or it's 3 fused bones, but 2 sections. So each section here is called a coxa, or coxae for plural. So here's a pelvis. This is going to be called your pelvic girdle here. It's made up of 2 coxa, or a coxae, and that's going to be a coxa right here. Now with this, the 3 bones that is going to be made up of, you've got the main portion, that's called the ilium, and it's going to have the iliac crest coming through here, so you do need to know that. You're going to have the pubis bone. Let you see, that's the pubis. And then you have the ischium. That's going to be this bone right here. That's your ischium. So the ilium, the pubis, and the ischium here. You have a nice large foramen. That's called the obturator foramen. You have one on each side. And then you have a nice indention here, which is going to be called the acetabulum. Now the acetabulum is going to articulate with your thigh bone, which is going to be called the femur. And so you see how it fits nicely into that acetabulum. And so those are the parts that you're going to need to know for the pelvis. Now with the pelvis also, you can tell if it's male or female several different ways. If it is more of a V up and down, can't see with this one, but it is a very strong V, that's going to be a male pelvis. This one, notice how it's a little bit more open. It's kind of a U or a rainbow shape. That is going to be a female. So 90 degrees or less, male. More than 90 degrees, it's going to be female. Another one, this one's more deep and like a cup. It's going to be very up and down, not very open in the center. This one, notice how the hips flare more and how it's more open inside here. That is also going to tell you that it's female. Now this joint here is a slightly movable joint. That's called the symphysis pubis or pubic symphysis, depending on what text or book that you read. And so that right there is slightly movable during pregnancy to allow for the baby to go into that birth canal. So that's what you need to know about the pelvis. Now let's go in and talk about the thigh bone. So with this, there's going to be several different parts. Another thing, you're also going to have to be able to orient yourself with this bone. So when orienting yourself, you always look for the head of the bone. Remember, that has to go in towards the middle portion of the body. And so with that, you then turn it around. That deep indention here is going to be the back. And so these are your condyles here. So turn it around. You got a nice soft space in the front. That's for the patella. And so you'll see that on your femur there. So that's called a patellar surface. All right, so going over the parts that you need to know. You've got your head. You've got the neck here. When you turn it around, you're going to have what's called trochanters. So you'll have this greater trochanter and you'll have a lesser trochanter. So see there, greater and lesser down here. Neck that comes around this area here. And then you're going to have what's called the condyles and epicondyles. So coming down on the back here, these are your condyles. And so medial section coming down, medial condyle. This is the lateral side, so that's your lateral condyle. The epicondyles are going to be just slightly above it. So this would be your medial epicondyle, and up here would be your lateral epicondyles. And so those are going to be your sections that you need to know there. Turning it around, you need to, I forgot about the back. You have your linea aspera right through here. And so you do need to know that part, that linea aspera. And then turning it around to the front, coming back to the head one more time, it's going to have this indention right here. That's going to be referred to as the fovea capitis. And that's on the head. So this is the anterior. We know it faces in medially. And so with this, if it faces in medially, this one's going to be my right hand side because this is my right hand. Medial body, head needs to face in medially, and this is anterior. We see this nice soft patellar surface, and we see posteriorly it has this deep indentation. Those are going to be the parts that you need to know for the femur. Next, we'll come down to the shin bone. That shin bone is going to be called the tibia. Now, with the tibia, it's going to have several different parts that you need to know. See how it articulates there. On the side of it, it's going to be the medial bone, so it's towards the center of the body. On the side, you're going to have a fibula. So I'll show you there how it orients. So that's how it will be attached in. So medial bone is the tibia. So with that tibia, you're going to have the tibial tuberosity here coming down. Since, this is the medial bone, and we're going to have this portion, if you look at the foot, is the medial side. So up here is going to be called your medial condyle. Over here is going to be called your lateral condyle. And so those are going to be the two parts that you need to know for condyles. Next, we're going to come down and you're going to have your malleolus. It's going to be a pointy piece. Notice how this points. I'll get closer. That's called the medial malleolus. So medial malleolus. Those are going to be the parts that you need to know for the tibia. The fibula comes in and fits in like this. What you need to know about the fibula is it's going to come out to the side here, and you have another pointy piece, and that's going to be called the lateral malleolus. So we've got the medial malleolus on the inner portion of the body, or medial portion, and the lateral malleolus on the side, or the lateral section. All right, so now let's get oriented with the tarsals. That's going to be your ankle bones. With the tarsals, you're going to have two larger ones. The heel bone, which is called the calcaneus. So that calcaneal tendon attaches in here from that gastrocnemius muscle, and that's also called the Achilles tendon. So that's your calcaneus or your heel. This bone here is going to be called the talus. It's a pretty big bone. That talus looks like it's spelled talus, but it's pronounced talus. So that's 2 of your 7. Next, I orient myself. I always look for the rectangular bones. So looking for this elongated rectangular bone here. That's called your navicular. So that was navicular. Right below it is going to be the cuboid. So you got your navicular and your cuboid. Then, coming over to the side of that, navicular, cuboid. I had the foot where I couldn't see it, so coming to the side. Then you're going to have your cuneiforms. So, going from the inside out with the cuneiforms, you're going to have your medial cuneiform, your intermediate cuneiform, and your lateral cuneiform. So your cuneiforms are going to be those 3. So, navicular, big cube shape, cuboid. Then you're going to have your lateral cuneiform, intermediate, and medial cuneiform. This is the inner portion of the foot. Next, you come down to your metatarsals. That's these here. It's going to be just like with the hand. The big toe is going to be shorter, and so that's going to be metatarsal 1, metatarsal 2, metatarsal 3, 4, and 5. Next, you have your toes, which are called phalanges, just like with your fingers. And so the big toe is going to have the proximal phalanx and the distal phalanx, and then the other toes, the rest of them, are going to have the proximal, middle, and distal phalanx. And so that is going to wrap us up for the parts that you need to know for your bone practicum. If you have any questions, feel free to contact me, and I'll be more than happy to help you. And see you later for our next video.